Mobile lung screening allows us to put a scanner on a vehicle and bring it out into all 5 boroughs of New York City. But it's not just about a scan, it's the entire navigation process, starting from when we speak with patients on the phone, scheduling their appointments, shared decision-making, the actual scan itself in a patient's local community where they are comfortable and close by, to the follow-up and even diagnostics and treatment when needed. When we go out into the community, we'll be looking for a needle in the haystack, individuals who meet very specific screening guidelines for this exam. The first step in lung screening is when a patient reaches out to our team. We greet them with a warm phone call and set them up for a shared decision-making visit with one of our nurse practitioners. During shared decision-making, our NPs speak with the patient to confirm eligibility, review risks and benefits of screening, and go over the process and what to expect. This is all about setting a patient up for success throughout an annual screening process. It's not about a single one-time CT scan. It's actually about returning on an annual basis and following up on any findings that we identify. When a patient enters our health screening van with low-dose CT, they're greeted by one of our patient coordinators. They quickly can get registered and then complete their scan. The low-dose CT scan is a quick and easy exam. For this, patients don't even need to undress. They simply lay down on a bed, slide in and out of a very large donut. Rather than a tube, it's a quick, open exam, slide in and out, and in less than 5 minutes, it's done. There's no preparation required, so no fasting, and there's no contrast administered, so no injections. Images are typically read by our radiologist within 24 to 48 hours of the exam, but many times this is completed same day. We try to get results to patients as quickly as possible, as we know there's a lot of anxiety for patients.
One thing that's very exciting about our program is that we offer something called a imaging review. Individuals who are interested are able to actually give us a call and sit down with one of our radiologists or via video visit to actually go over their CAT scan. Gives us an opportunity to make you feel a little bit more comfortable as to what exactly was found and to answer your questions. From a provider standpoint, it's also exciting for us because it offers us something called a teachable moment, an ability for us to really sit down and educate individuals on what it is that we're concerned about on a scan. And it may not necessarily be a specific lung nodule. One of the most common things that I speak to individuals about is emphysema. Unfortunately, for people who are heavy smokers, they do develop a disease in their chest called emphysema, or holes in their lung, that are unfortunately irreversible. However, we can do a lot about educating individuals on smoking cessation or on stopping smoking so that this specific disease doesn't get worse. Additionally, because we are doing a CAT scan of the entire chest, we do find a lot of other things. And so we get a nice snapshot of that to give us an idea of whether or not we would recommend actually further evaluation with a more dedicated scan. We are very fortunate that here at Weill Cornell Medicine, our cancer center, the Meyer Cancer Center, is working very closely with the Herbert Irving Cancer Center at Columbia University to bring this to the public. Having a mobile lung cancer screening unit is very exciting. It allows us to actually bring this technology, this service, and education to people where they're most comfortable, where they live, and really, in the end, is being able to meet people where they are to offer this potentially life-saving service, because early detection saves lives.